I use C8 Help to organize all of our medical information about our residency as well as for our department. We use it to organize what we believe to be best practices, as well as a mechanism to distribute all sorts of new material that we want our faculty, staff, and residents to be up on. Things like important papers, changing guidelines, as well as maintaining their education through new articles, practice questions, oral board stems, et cetera, et cetera. We use it all the time. I personally used it earlier this week. I was doing a kidney transplant and I asked the resident, it's like, okay, it's time to check a gas and change the fluids. What, fluid should we use to, or should we change it to? We pulled up the app, we typed in, kidney transplant, and boom, 2 seconds later, the policy was on the page with a table of, fluid management strategies. So in that way, we were easily to demonstrate how quickly and effortlessly we were able to get up actionable information to use in the operating room. A couple of things. So as a role as a practicing anesthesiologist, it's nice to know that I have an easy way to get the information that I need, that's curated information, that's up to date, that's accurate, really, really easily through our institutional departmental website and the C8 widget, which obviously leads to the app. But I'd say probably the biggest change has been as my role of vice chair of education. Having an easy way to put information and disseminate information to everybody in the department makes my job a lot easier and a lot more efficient. I also feel like we have a good hold on making sure that the resources that our faculty and staff are using are the best ones that can teach them what they need to know. So if they want to look up, for example, what is, how to do a supraclavicular block, I don't have to worry that they're pulling up, YouTube videos and articles that are either old or outdated or use some other technique that I've never heard of. I know full well that they've picked the video that our regional anesthesia department has handpicked as the best video to teach them that technique. So being able to say that for pretty much every which way we run our operating rooms in terms of what is the best way to do what, or how to find out what is the best way to do what, has really changed the way that I've fulfilled my role as vice chair of education. Everybody. Even though I'm an anesthesiologist, this sort of problem exists uniformly in medicine. So you could easily and should benefit if you're, a surgeon, if you're doing internal medicine, neurology, psychiatry, it sort of really doesn't matter. As physicians, we're consistently changing how we do things, and the pace at which things are becoming obsolete and need to be updated just, keeps going over and over and keeps getting faster. So anybody who is into medical education or wants to keep up with, the latest knowledge and find a good way to organize that knowledge, so that way, it's easily disseminated, those are the kinds of people who would use C8 Help.